Hi, my name is Dr. Mostovoy, and I've been working in the field of breast cancer prevention for the past 15 years. I'd like to share with you a PowerPoint presentation that I presented specifically to empower women, because what's going on in the healthcare today is not really effective, and we needlessly concentrate on breast cancer detection rather than breast cancer prevention. Detection may be important, but by the time breast cancer is detected, usually it takes anywhere between 8 to 9 years, and sometimes even longer, to detect breast cancer. So it certainly is not early detection. I would say that it's actually quite late detection. Well, detection is equated with prevention. Of course, nothing can be further from the truth. So my message today to women out there is that there are many ways that you can prevent breast cancer. If you follow the 10-step program that I've outlined for you, you can drastically reduce your chances of dealing with this disease. So give me a second. I will just switch to another screen, and we'll go over this PowerPoint presentation in the next couple of minutes. Here we go. And there we go. 10 ways to prevent breast cancer. Now, the reason I am saying this is because I truly believe that breast cancer is a preventable disease. With the American Institute for Cancer Research, as you can see on your screen, they are suggesting that a third of most common cancers can be preventable. If you look at the pink bubble on your screen, you can see that they're suggesting that 38% of cancers per year, or 88,000 women, do not really have to deal with this disease. I personally feel that this number is way too conservative. It's probably much closer to 2/3 or double this number of women in Canada and the United States that really don't need to get breast cancer each and every year. And we're talking about probably close to 200,000 women a year. When it comes to colorectal cancer, the estimate is 50%. When it comes to mouth, laryngeal cancers, it's 63%, and so on and so forth. So clearly, this shows that most of the cancers are preventable. Let me show you how. Before we get into this discussion, I would like to pose a question: what is cancer? Because in this day and age, there is a myth that's very, very prevalent, and unfortunately it's not very helpful, because it's not really empowering by suggesting that cancer is caused by our genes. Well, that's not exactly true. It's only 2% of cancer that is genetic in origin. 98% of cancer is actually caused by lifestyle as well as environment. And 100% of cancer is influenced by lifestyle. So when we're talking about prevention versus detection, breast cancer, once again, is a preventable disease. So what I'm suggesting is that we should change our focus from breast cancer awareness, which is really mostly dealing with fear, to breast cancer prevention, which is providing us with some action that we can all take. And I'd rather deal with action than with fear anytime. Number one, regulate your estrogen metabolism. Some estrogens are cancer protective, while of course others are cancer permissive. They're not all created equal. We're looking at estrone, estradiol, and estriol. Estriol is 80%, estradiol 10%, and estrone is 10%. And as long as they're in that ratio, everything seems to be working. Now, estriol is a hormone of pregnancy, and we all know that when women are pregnant, they are protected from breast cancer as well as many other diseases. Estradiol, on the other hand, is cancer-permissive estrogen, and too much of this particular estrogen definitely increases the risk for breast cancer. Number 2, synthetic HRT. Avoid hormone replacement therapy. Synthetic HRT increases the risk of breast cancer. On the other hand, bioidentical HRT is safe. Now, let me also suggest that, of course, it's very important that you seek a competent healthcare provider who has had quite a lot of experience when it comes to hormone replacement, specifically bioidentical hormone replacement. Number 3, limit or avoid birth control pill. Even the least potent pill contains 7 times the amount of estrogen naturally occurring in your body. So obviously, it's going to have an effect on you. Number 4, limit your exposure to xenoestrogens. What are xenoestrogens? These are chemicals and industrial pollutants that mimic the effects of estrogen on your body. As you can see at the bottom of your screen, there are estrogen receptor sites, and when estrogen comes in, it affects it by giving a certain signal. When xenoestrogen, which mimic estrogen, they occupy that receptor site, and unfortunately, it's not giving us the same signal. So as the signal is being changed, so is the reaction in your body that's also being changed. Number 5, do your own breast self-examination. The more you examine your breasts, the more you will learn what is normal for you. Now, it's going to be easier after a while to tell whether something unusual is coming up for you. Once you get to know your breast, you will know what's normal. And here I wanted to illustrate that there are 12 signs of breast cancer. There is hardening, pinching, skin erosion, and so on and so forth. You can take a look at that at your leisure. But one thing I'd like to point out that 70% of all breast cancer lumps are found by women with their own breast self-examination. It's very important to understand this. Number 6, exercise and fitness activity. Well, studies have shown repeatedly that 3 to 4 hours per week of regular exercise can decrease your risk of breast cancer by up to 50%. In other words, your lean body mass or your muscle does not generate estrogen like fatty tissue. Number 7, proper nutrition. Eating a low saturated fat with high fiber has been shown to be beneficial for breast health. As you know, I am a big proponent of the anti-estrogenic diet, which simply means that you start eating foods lower on the food chain. Things like fruits, vegetables, legumes, roots, nuts, seeds, eggs, even wild fish or fresh dairy are permissible. Now, what's not permissible is that you need to stay away from processed grains. Actually, you need to stay away from processed foods, period. But processed grains, things like sugar or overfed farm animals, refined, processed, or chemically loaded foods, these are really, really foods that you need to stay away from. And of course, you need to eat organic whenever possible. Number 8, low-functioning thyroid, or what is known as hypothyroid, precedes most breast conditions. By correcting this problem as early as your first symptoms develop, you will decrease your risk factors and improve your breast health. Number 9, stress and trauma play a major role in most health conditions. So breast cancer, of course, is no exception. We're not just a physical body. Your emotions and thoughts directly influence your physical health. Almost everyone can use some help in this area. And once you do, you can really attain real health and well-being. Finally, number 10. We're dealing with breast thermography. So in addition to your regular medical examinations, thermography can be used as a useful risk assessment tool and an early warning system. By properly understanding your risk for breast cancer, you can develop strategies of lowering these factors before cancer has a chance to develop. And I want to emphasize that early risk assessment could be life-saving. If you're not familiar with thermography, I invite you to visit our website at www.thermographyclinic.com. So in summary, what can you do? Quite simply, avoid chemicals, electromagnetic radiation, environmental carcinogens, balance hormones, address endocrine disorders like thyroid or maybe adrenal support, maintain proper weight, start an anti-estrogenic diet, maintain healthy nutrition, practice breast self-examination, as well as safe screening modalities like thermography. Emotional health issues should not be neglected. Activate your lymph and immune systems, correct your nutrient and vitamin deficiencies, and you really don't need to guess. You can test what is it that you're deficient in. Dental and oral health, that's a whole new subject that I'm definitely going to do a whole program on with illustrations of how important it is and how very few, even healthcare professionals, know or pay attention to this. Let me ask you a simple question. When was the last time your medical doctor asked you about your dental health? Probably never. And that's very, very detrimental. Physical activity and fitness, reducing stress, and finally, create a life of purpose, because it's very important that we have purpose with our life. We are allowed our own self-expression, we are empowered, and of course, we're happy when we have all this in place. So I want to leave you with this thought that your health really does not get better by chance. It doesn't get better by a quick fix here and there. It will get better by change and, of course, the lifestyle choices that you make. Now, for additional information, here's the information for you that you can go to and get the full article that will explain all of the above 10 ways to prevent breast cancer in greater detail. And I just wanted to mention that preventing breast cancer is far more important and powerful than simply trying to detect this. So if we are going to make a dent in breast cancer statistics, I think that we're going to take personal responsibility and start doing what we need to do each individually. Until then, I bid you all good health and be happy.